Juvéderm Skinvive. It is a skin quality product. It comes in this box with 2 ml of product, each of it with 2 needles, 32 gauge needles. I'm Dr. Amalia Anghel. I'm a dermatologist from Bucharest, Romania, and today we are with my patient. She's Elena, she's 28 years old, and her main concern are the scars and the full face texture. How we can see, she's having some acne scars a few years ago, and some very deep scars on her forehead, which are post-traumatic scars. This is her concern. Here we choose to combine protocols for this scarring and the fibrotic scarring, which are quite difficult to be treated. And in SkinMed we choose to have these fractional lasers with injectables. I always choose Juvéderm Skinvive at the end of my protocol just for texture and skin quality. So if I would name a protocol for my patient, it will be with 4 sessions of fractional CO2 laser, and at the end we will inject Juvéderm Skinvive for the skin quality and her overall aspect. We do like this just because we need to have a proper skin quality in order to inject. We know that the fibrotic scars are deep and they are in contact with the deeper layers, so we need to inject the acid after we have this kind of subcision, and that's why in this case we will have the maximum effect. If we see, we have a lot of scars. They are quite deep scars and almost covering the full cheek. She's also concerned about this scarring on the forehead, which are very deep, how we can see, and quite old and fibrotic. Why we don't inject just the scars? Because this can be also an idea when we treat scars. We need to inject the full face, just because we would want to have a more uniform aspect of the face. So approaching the scar, it means approaching the full area. Juvéderm Skinvive, this is my favorite type of acid. It is a hyaluronic cross-linked acid for skin quality, texture, and firmity. With this, I can achieve a very nice and very good result for her full face, also for the scarring. There is a single injection with a minimum recovery time, and we have the next injection after 9 months. Of course, we check the skin and the skin needs. So this we choose for today, which is very good for my patient case. Why I choose Skinvive? Just because for me it is very important to have a good product, which is the best, very few sessions and the maximum result. For me, Skinvive will have just 1 single injection comparing with other treatments like mesotherapy or microneedling or also PRP, in which we have many sessions, like 4 to 5 sessions, 2 weeks to 1 month apart. So for Skinvive, I have just 1 injection, 1 session of injection. We have very good result for the texture of the skin and also for her scars, and we have the recovery time just for this single session. So for my last year's experience, my favorite is this hyaluronic acid. If we talk about skin quality, we talk about the turnover of the cells, which is very important for us. We talk about hydration, we talk about skin barrier, and also we talk about firmity. And all of this we can achieve with the Juvéderm Skinvive. We increase the hydration level of the skin, we activate the fibroblast and also the turnover of the cells. So in this way, we will achieve a new skin quality, which is mandatory to have it for this natural aspect of the face. In SkinMed, when we talk about scars, we have these combined protocols, which are laser treatments, non-fractional, but for the chronic and fibrotic old scars, we use fractional lasers. And for me personal, I always make a final session of Juvéderm Skinvive in order to have the greatest improvement for skin quality. So very good cleaning. We need to clean, double clean, all the time clean. I start from the lateral, and I recommend this because we will calibrate the treatment over here. All the time we have the needle like down, just because we know that this is a product to be injected in a deeper layer. To be honest, we need to be very careful to the deeper layer, just because they are patients with very thin skin, and dermis means superficial, and we need to be very careful. The angle is about 45, and we stretch the skin when we inject. Covering the full area of the face, around 1 centimeter apart, how we've seen, with a marking around 20 points of injection with 0.05 ml of Juvéderm Skinvive. The proper way to inject is to be careful and to stay in the dermis area. This is the ideal. And for being in the dermis, we need to be very careful at the needle angle. Yes, we stay around 45, just because if we stay very close to the skin, we'll be superficial. And if we go perpendicular, we will stay a bit deep. We need to be in the dermis. And how we see the bleeding is minimal. And after half of the syringe, I change it with the other one, or I change the needle, just because needle should be new for the minimum interfere with the skin. Again, 45. Careful with the needle when we take out of the skin. We should take the needle from the pressing, just because we can leave the substance in the superficial layers of the skin. How we see, she's having here probably a post-traumatic, yes, scar over here. I will work a bit on the scar, so I keep the level of the dermis and I mark the scar, which is enough for this. And this scarring is a bit fibrotic. We need to be very careful, because the placement of the product should be beneath the scar, so otherwise we will stay with the papules visible on the skin, and we know that this will be for the next 6 to 9 months if we are not careful and injecting properly in the dermis. So we need to be very careful when we have the fibrotic scars, because the acid should be placed in the deeper dermis. So 45 degrees, 1 centimeter apart. Be careful, because here we have vessels and we need to be very careful. Let's stay in the dermis part. If we can see, if we massage the papules, they will go. This is the right place to inject, because here we have the maximum result. If we'll be in the deeper layers, in the subdermal layers, we will have a result for sure, but we lose from the capacity, the maximum capacity of Juvéderm Skinvive. Very careful with the glabellar area, just because we have the vessels, and here they can be inside the dermis, subdermal, so we need to be very careful. The scarring, she's having the scars. Here, I will go under the scar just to make a place and I inject. This is not for the filling effect. We want to have a new quality of the skin and this scar to lose and to mix with the surrounding skin. Very carefully the vessels. The bruising depends on your attention to the vessels. We need to cover the full area, which it means that we can go vertical or in horizontal, yes, stretching the skin to have the injection in the dermis. At the end of the treatment, we will do a deep cleaning again. We massage if we have something to massage, otherwise we do it before while I was injecting. And we can see that we have very small bleeding points, almost no bruising. So the face, it looks very good. We don't need to do anything very important, just we can apply a repairing cream with an SPF, and I recommend the patients not to apply makeup today, just because we still have some opening points and can be gates for other things to happen. So she needs to be very careful for today while she's taking care of the face. So I recommend her to have a good washing at home, just to apply a repairing cream or a regular cream, no retinol. Also, you don't need to go in the hot areas like saunas or hot tubes, just because you can have a bit of more redness. We don't have any recovery time, so you can go and be going to your day. How we can see after almost 1 month, the full texture of the skin is improved, also the quality and the appearance of the scars. So we have a very nice and natural result with a big improvement of her scarring.